Our detailed analysis has found that the pandemic has created a backlog of over 110,000 surgical and diagnostic procedures.
It's a staggering number, over 100,000 procedures awaiting action as the pandemic continues to exhaust hospital resources. Doctors Manitoba calling on the province to create a task force to start tackling that list.
This is a top concern for physicians in this province. And we know it's a top concern for Manitobans as well.
Doctors Manitoba says over 39,000 surgeries, 44,000 diagnostic imaging tests, and 32,000 other tests like mammograms are waiting to be completed. A report from Doctors Manitoba says at least 2 patients have died while on the wait list for heart surgery, while others wait in pain and discomfort for their turn, deteriorating.
Just last week, I had a patient who had presented with an infection with their gallbladder. I saw them 3 months previous. They were having just gallbladder attacks. And I had the surgeon see them, the pain had subsided. And so they said, well, because of the backlog, we're not able to take out your gallbladder today. Well, just last week, that patient came back in severe pain and with a very serious infection requiring an emergent surgery.
In April of last year, some surgeries resumed but had to be postponed during the next wave, and it happened again this year. Doctors Manitoba has released 3 recommendations to the province. They're asking the province to set a fixed date to solve the backlog by providing all necessary funding. They want to see a surgery and diagnostic recovery task force be assembled consisting of both healthcare leaders and frontline staff, as well as addressing the nursing shortage to expedite the process. Finally, they recommend full transparency with monthly progress reports on backlog and future plans of action. NDP healthcare critic Uzoma Asaguera echoed these recommendations in a statement to media, also saying in part, "It's shocking and reckless that 15 months into the pandemic, the government still doesn't have a plan to address the 110,000 plus backlog for surgeries and tests, many of which are serious and life-saving. After years of PC healthcare cuts, it's clear we don't have the capacity to address this backlog." Acting Health Minister Kelvin Gertson says they're currently reviewing the report. He says our government began taking action to address this backlog when the effects of the pandemic first impacted our surgery capacity. We have contracted with organizations such as Cancer Care Manitoba and Western Surgery Centre to perform over 11,000 additional procedures to begin to address the backlog caused by COVID-19. In March of this year, our government also announced an investment of at least $50 million targeted to reduce surgical wait times as part of Budget 2021. Doctors Manitoba say they are ready and willing to take on more work to address the backlog, and they're ready now. In Winnipeg, Mike Albanese, City News.